If she was able to get in.
She's texting. Yeah.
Okay.
Call this special meeting to order. It's June the 11th, and I believe we have some supervisors attending by telephone. So if the clerk could verify.
Supervisor Angus?
Yes.
Supervisor Johnson?
Present.
Supervisor Gould?
Here.
And I believe Supervisor Watson will not be attending today, from what I understand.
Okay, and obviously I am here. So we'll go on. The first item will be a discussion of possible action, an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19 updates and taking the necessary actions based on those updates. Good afternoon, Ms. Burley.
Good morning, Madam Chair, members of the board. Thank you for allowing time for an update this afternoon. I'll start with the numbers. And first and foremost, we are at 555 cases in the county. And we're seeing a number, a fairly large size increase in cases per day. And I think there's some issues around that I'd like to discuss, and I'll get to that a little bit later on in the presentation. We are working on, to Supervisor Johnson's question on Monday, we are working down on a new breakdown of ages for those lower age ranges. As they sit now, it's 0 to 18 and 19 to 29. What we're looking at is a breakdown of 0 to 10, 11 to 19, and then moving that other age group to 20 to 29. I believe we're pretty close to having that ready to go on the website, and I think we may be able to actually start this afternoon in the reporting process out to the public and for the press release. If not, we will certainly have that ready to go for tomorrow.
Okay, good.
Okay. For surveillance of surrounding counties, we usually try to address some of the considerations for cases that are surrounding us, and Laughlin is currently reporting 5 cases, and Needles is currently reporting 2 cases, and that was as of this morning's reports that were available at that time on their webpage. I know that there's some questions about hospital capacity, and there have been a number of reports, statewide reports, that discuss the ICU bed capacity sitting at about 17% availability at this point. I know that fluctuates day to day based on patient care and patient needs. This does not include the additional surge bed capacity. So this is their normal ICU bed capacity based on what we've been told by ADHS. So to be clear, that doesn't include the 625 beds that apparently throughout the state we could surge to. In looking at the hospital status update, it looks as if we've got an increase in the use of our ICU beds throughout the county. And I'm sure they are monitoring that situation very closely and are prepared in any instance to be able to open up additional beds when necessary. It is, of course, to you and I and everybody else, I believe, concerning that we're seeing this increase in the ICU bed use and need, and it may actually trigger, as I understand it, a cancellation of elective surgeries at some point. There is a trigger point, and I believe it was at 80%, but I don't know if that's a statewide use of that or if that is a hospital-by-hospital case where they've submitted an application to and went through the waiver criteria for elective surgeries, and then they are, if they hit an 80% ICU bed capacity, then they're unable to perform those at that point. Or they'll have to cancel them moving forward. So that is something that I can learn a little bit more about at what level that decision is made, if that's a state-level decision or if that's an individual facility decision based on their ICU bed usage. Okay. There's been some questions about testing in the county, and I know that Supervisor Johnson had asked if we would be able to put the some of the locations that offer testing on our webpage. We do have one location, so we actually have a couple. There's a couple of different directions we could go with this. The first is that ADHS allows you to type in your zip code in their webpage on their testing site and identify testing locations. Now, I realize that at this point, if you went into Mojave County, there's few, if any, options. And so what we're trying to do is encourage those groups that are testing to register on their site, which will make it much easier for the public to search out those testing sites, in addition to looking at what we put on our own site. So we're getting confirmation from those locations that are offering testing to make sure that they would allow us to post that information. And we do have permission currently from NextCare in Lake Havasu City. I believe that's also called Troyer Urgent Care in Lake Havasu City. So we'll be adding that to our page. And then North Country Healthcare is testing patients who are symptomatic and a North Country Healthcare patient. So we'll continue to build on that and look at how we can work with our partners in the communities to increase testing. And when we talk about increasing testing, we're really talking about increasing testing for symptomatic individuals. And we're also talking about increasing testing, potentially, if we were to expand beyond that, for individuals who are close contacts of positive cases, because those are the recommended groups that we should be trying to increase testing for. And so we want to focus on those based on the capacity within our communities to increase testing.
Okay.
Okay. I have on the phone Mayor Schumacher. As you know, she's our temporary epidemiologist that's been working with us on a special assignment. And what she has put together is a presentation on contact tracing at our department. And I think this is important because obviously there's been a lot of attention on contact tracing in our community and throughout the state and the country about its importance. And I want to be sure that there's an overview provided to all of you so you have a general understanding of what that process looks like, how it works in our county. And at the very end of that, it'll talk a little bit more about the number of cases that our staff have followed up on, and then sort of those next steps. So, Mayor, if you could introduce yourself.
Madam Chair?
Okay.
Supervisor Angus, go ahead.
I'm sorry, I tried speaking, but I had myself on mute. I wanted to just ask a question about something that Denise was talking about before. I need a little clarity.
Sure.
About people who believe they have been exposed to a positive case. When they call, if somebody calls the health department and asks them what they should do if they believe they and their family have been exposed, what does the health department tell them to do? What do you instruct them to do?
Well, we would certainly want them to seek out testing if that's available in their community.
Okay, so the problem was, I heard this from a doctor from a hospital. So he says that a family came into the hospital telling them that the county told them to go to the hospital and get tested, when, you know, we know that that's not something that the hospital is going to do if they have no symptoms. So if we can just sort of be more clear as to where that they should go be testing if they are not symptomatic.
Right. Good point. Okay. Okay, so that was the point, right? That this particular family had been exposed but were not symptomatic?
Right.
So in those
so they
cases,
went with the whole family to the hospital.
So in those cases, we may be asking that family to monitor for symptoms as well. And Mayor, is there anything other guidance-wise that we would provide them?
Yeah, that's right. And we actually are very careful about telling folks not to go to the hospital without needing to go there and without warning people, because of course we don't want to expose people at the hospital.
Right. Okay, thank you. So if we can just put that into some kind of policy and be clearer so people don't, waste their time going and expose others that we don't want them to be exposed to.
Certainly.
Thanks.
Absolutely. Thank you for the question.
Okay, Denise, you can go on with your presentation now.
Okay, Mayor, why don't you go ahead and run through. We've got some slides available for you to kind of run through this process, okay?
Right. So, Madam Chair and Supervisors, thank you for letting us talk about this today. I know a lot of people have questions about what contact tracing is and how we do it. And I've actually been doing it with the nurses and EPIs at Mojave County, so I'll be very happy at the end to answer any questions you have about it.
Okay.
If we go to the first slide, it all starts with somebody getting a test. And it's called a nasopharyngeal swab. You can see that it's quite long, and it kind of goes deep back into the nose. And then that gets put into a tube, sent to a lab, or tested at the location where it is, and that, results in a positive test. If it's a negative test, we don't hear about it, but if it's a positive, it gets sent to us, which is on slide number 3. We get tests from anywhere, from labs, from clinics, from doctor's office. All those positive tests, the results come into us. And so we have those. In the next slide, slide 4, the next thing that happens is our team of 5 investigates every single positive case that comes in. We have a long questionnaire for them, series of questions. We ask, were they hospitalized or are they hospitalized? What symptoms did they have? When did those symptoms start? Do they have comorbidities? In other words, do they have diabetes or hypertension or some other things that might put them at risk? Do they need a thermometer so they can check their fever? Do they need a quarantine letter so they can tell their doctor, they can tell their employer that they won't be coming to work for a few weeks? We really dig into that. And then, of course, the contact tracing part of it is the next slide. We ask, who else lives in your household? So that may be children, that may be housemates, that may be roommates. We get the names and dates of birth for all of those people and record them. Then we ask the next thing, which is on the next slide, who are your close contacts outside of the home? And this means, a close contact means you must have spent time with them in the 48 hours before your test, where you had at least 15 minutes where you were unmasked and not distancing. So this picture I show here is an epidemiologist's nightmare. I'm sure this was taken before COVID, I hope so, but that would be people who are very close together talking, and they may be able to inhale droplets. On the next slide, I want to walk you through the way that we do the quarantine. So for the case themselves, the positive case, they need to stay inside for 10 days. And we kind of use the phrase, no one comes in, no one goes out. You and your household, we're going to put a circle around your household, and everyone is going to stay in there. I often will ask, do you have someone, if you run out of food, who can bring you food? We kind of talk about their situation to make sure they're going to be able to manage that. After 10 days, as long as that case is no longer having a fever, is no longer having any symptoms, then we let that case out of the house. They don't have to be quarantined anymore. They should still be masking and distancing. They still should be doing the new COVID normal, but they are allowed now to go out. The rest of the family, though, now starts a 14-day quarantine. So they are kept until day 24 after the test, and they have to stay in the household until then. Now, this is the hardest one to explain to people. The reason we have to do that is you've probably heard that the disease can incubate for up to 14 days. So that means if I'm quarantined in the house with my husband, he might give it to me on day 9 of his quarantine, and then I'm incubating it, and I start having symptoms in the middle of the next week. So I need to stay in for those entire 2 weeks to make sure that the disease has not spread. And remember, we have some people who won't even show any symptoms at all, so we want to make sure they're not out spreading it without even knowing it. So on day 24, that family, everyone is now released. Unless somebody in the household does turn up to have symptoms or to have a positive test, in which case we're going to quarantine them longer, depending on when their test was or on when their symptoms started. For people who are close contacts outside of the house, so like the people we saw at that gathering together, their first day that we start counting from is the last time they were in close contact with that positive case. And they now need to stay in for 14 days. So we ask them to stay at home. No one goes in, no one goes out. And then in 14 days, as long as they haven't developed any symptoms or had a positive test, the investigator releases them. Now, during this time, during these days while everyone is quarantined at home, we have a monitor or back to one of the investigators is checking in with these folks on their quarantine. And what we're asking them is, are you still staying in quarantine? Is everything going okay? So we're sort of reminding them, you've got a few more days to go. And then, of course, we want to know if they have symptoms because they might be developing the disease. So we can have a monitor call them, or if they opt to do this, and I'm finding a lot of, especially the younger folks like to do this, we can have a text sent to them every day automatically from an automated system we've been using called Sarah Alert. And this is only if the case or contact wants to use this. What they get then every day in a text is this screen that asks them, are you having any of these symptoms? And if they are, they aren't. They fill it out and they submit. And then, if you look at the next slide, we are monitoring it. Now, I just want to say I don't have 7 screens in front of me all day, but I can go to my Sarah Alert dashboard and I can check in and see if any of the cases that I'm monitoring, any of the cases that I interviewed, excuse me, back in that interview, if any of them are having symptoms or are not reporting, and that way I can call them. On the next slide is what happens at the end of the quarantine. The investigator calls back. Now remember, they've been monitored. We've been talking to them all along the way, or they've been getting texts along the way. But right before we let them out of quarantine again, we just check in with them. They have to be fever-free for at least 3 days, and their symptoms must be a lot better than they were. So they must have improved symptoms and fever-free before they can return to, I don't call it normal because you might be thinking of the old normal, but at least they can return to the new COVID normal, which is we still want them distancing and masking when they're close to people, but they can return to work and so on at this point. The next slide is the estimated contact tracing that we have done at the Public Health Department. And when I say we, this is the nurses, the epidemiologist, Anna, and the people who've been helping with monitoring. Some are admin assistants, some are other people, health educators and so on, who we've borrowed to help out with this. So we have interviewed and quarantined 500, this is an estimate, around 500 confirmed cases, which you know from the count of cases. But then for every one of those cases, I'm estimating an average of maybe 3 contacts. So we've also talked to and quarantined 1,500 at least contacts. And we check in with those contacts at least 6 times over the 2 weeks. 3 times a week or every other day or sometimes every day. So that makes for a grand total of about 14,000 communications with cases and contacts. Did someone have a question?
Does anyone have any questions for the? That's a lot of contacts. I can
Sure
see.
is, yeah.
I can see why you're so busy.
Yeah, we are. So I just want to say this is our second best defense against COVID, is identifying people, keeping them isolated, and making sure they can't go out and infect other people, right? But our first best, if I can call it that, strategy would be to prevent cases in the first place. Obviously, if we could keep these cases from happening, we wouldn't have to do 14,000 contacts. Maybe we'd only have to do a much smaller number if we could keep most people from, having close contact with others without masking. So Denise mentioned the rise in cases. This is what's been happening. It's becoming more and more unwieldy as we go. So last week we had over 100 around 100 cases. And as you can see in the blue part of the column, a lot of those are coming from non-long-term care facility cases. And so that concerns us because that means that's people in the community infecting each other, and we can't isolate them very nicely like we can in a long-term care facility. So we're hoping that they're observing the quarantine we're asking them to keep. And some people, if they're not in a long-term care facility, are hard to track down. Sometimes they don't give a correct phone number, or they've moved, or we have to spend some time tracking them down before we can even do that case interview and put them into quarantine. So we're thinking, why is this happening? Why are we having so many? And, my theory is I think there's some misperception. It's not just my theory. I think it's a lot of people's theories. But I think when we said, it's time to reopen, let's get the businesses going again and let's get our community operating again, which is a good idea. I think what we had in mind is, okay, this is going to be the new COVID normal. So we'll have things like social distancing at work, and there are ways to, set up offices and to wear masks. I know at a lot of stores now, all the employees wear masks so that they can't infect the customers. Customers still can infect them if they're not wearing masks, but it's a start. So that's what we had in mind. But I think some people heard it's time to reopen, and what they thought was, okay, woo, it's a free-for-all again, and we can get back with our friends and our family and just pretty much do whatever we want. And so that may be a part of it. So we kind of have a two-pronged strategy, we think, to try to deal with where we are right now. One is to do more of this contact tracing, to get some more resources on that. And we have some new temp staff working already, just started this week, are helping out tremendously. The State Health Department epidemiologists are helping us do the actual case interviews, which it takes some skill to do, so we need experienced people to do that. And then there's some federal and state that's passed through the state funding coming up that we're going to apply for. So that's doing more of what we talked about in this presentation. Then the other piece of it is what I just mentioned, which is we definitely need to do some prevention as well, I hope, where we can try to communicate to people that COVID-19 is still a threat, and that gathering in groups or not wearing a mask, or many of these activities can make people ill or even cause death, as we know.
Has left the conference.
And so this is our new normal. We want that to be our normal, at least for a while, till we can develop a vaccine. Do you have any questions for me? That's what I have in the presentation.
Madam Chair?
Supervisor Angus.
I have a question on this slide that differentiates between long-term care facility related cases and non-long-term. So when you have this yellow part, is that every case that's associated with the long-term care facility, so all of the residents and all of the healthcare workers and then all of the healthcare workers' families? Because I was hearing that that's why these numbers were going up, because of sort of the trickle down from all of the long-term care facility cases.
Mayor, do you want to answer?
Denise?
Yeah.
Yeah, correct me if I'm wrong, but I believe these are confirmed cases of staff and residents. It would not count the staff's family in that count. It would be staff or residents of a long-term care facility, but we can double check that to make sure.
When you do your investigation, and you would find out that they probably got infected from one of the healthcare workers going home, living life. That is not included. So you're saying those are new cases when essentially they are connected to the health care, the long-term health care facility.
I think if I'm understanding what you're saying, they're all new cases that week.
Right,
So
but since you're differentiating between long-term care facility and you say related cases, I would think that if any of these, all right, so let's look at the last week, 37, 63. So if any of those 63 are somehow attached to the 37 from healthcare workers who have gone home, doesn't your investigation tell that story?
Right, that's a great question. I do know that would be staff and residents in that 37.
Right,
I want to check. Yeah. That's the part I want to check for you.
Because I think that's important. So we're saying now that this is widespread community spread, which it kind of is, but it's still related to those cases. That I just think that is an important piece of information that people should have.
Absolutely, and I will double check that. I think from watching what's coming in, I think all, if not the majority of those 63 are not families or are not related to the long-term care facility workers or residents. However, again, I want to check to be absolutely sure.
Thank you, I appreciate it.
Because that's an excellent point.
Okay, does anyone have any other questions? Hearing none, thank you very much for that presentation.
Yes. Thank you. Thanks, Mayor.
Thank you.
Madam Chair, I have another question for Denise.
Well, go ahead, Supervisor Angus.
I heard from somebody who is involved in a skilled nursing, a long-term health facility, and this person had some concerns with the way things are reported, and this is sort of a statement and a question. So this is a statement from this person that the CVC collectively groups nursing homes, skilled nursing facilities, and assisted living facilities under long-term care facilities. But, and they're collectively grouped together, but under the Arizona Department of Health Services, their licensing and regulatory agencies and assisted living, they're not collectively grouped together, and that those long-term care facilities also have completely different regulations under DHS than assisted living facilities. That they're very different is the point. This is from somebody who works in that world, okay? So the question is, without disclosing the name of the organization, would it be possible to specify if it is a skilled nursing facility, an assisted living facility, or congregate care setting group home that has the positive COVID-19 cases? But if that's not possible, could it be further explained that the community, that the phrase long-term care facility collectively does include the skilled nursing facilities, assisted living facilities, and congregate care group homes when reporting positive COVID-19 cases? Because I think there is a sort of I think what the point is that there's a kind of a misperception about, what's going on in these homes because their level of regulation is different.
Right, certainly. I can check on that, Supervisor Angus, and see what we can do, okay?
Yeah, thank you very much.
Certainly.
Madam Chair?
Supervisor Johnson.
Thank you, Madam Chair. If Denise is done, I have questions. If not, I'll wait till she's finished.
Were there any other specific questions related to the contact tracing presentation?
So I don't have any questions, Denise, but there does seem to be apparently just a lack of interest in social distancing and wearing masks and everything. So I'm really appreciative that this PowerPoint was presented, and as, if nothing else, a reminder and a good way to reach back out to our people and try to re-educate them. So thank you.
Certainly. And finally, in the presentation, it's really to look at ways that we can send messaging out to the community and look at different strategies that we may be able to use, maybe some different messaging entirely to try to reach different target populations and give people a different lens to look at the coronavirus and COVID-19 through. So we'll be working with the communications director and others to try to develop that and move that forward.
Denise, can you explain why there's so many false positive cases out there? That seems to be concerning to some folks.
False positives. Are they getting... Mary, are you still on the phone?
Yes, I am.
Do we have a lot of false positive tests results coming in?
I wasn't aware of that. I haven't seen very many at all. I know we've had a lot of false negatives on the rapid test.
Right. And that's a known fact. So when, for example, we use the Abbott ID testing machine, the rapid testing for COVID-19, if we get a negative result, we actually send that result down to the state lab for additional testing to get a confirmatory negative result, or at least a test, to determine if it's truly negative. A positive is a positive, but a negative needs confirmatory testing on it.
Okay, thanks for that explanation.
Mm-hmm. Yeah, and if somebody, if a resident is getting a false positive, I mean, that's something they would want to talk to their provider about right away, because that's important to know.
Correct.
Yeah.
Okay. Any other? So Supervisor Johnson, I believe, had some questions.
Okay, Supervisor Johnson, you have the floor now.
Thank you, Madam Chair. On our agenda today, we have a request from two different governmental entities to use our boardroom for public meetings. With Arizona being in the top 3 states for new cases, and Mojave County having one of the highest death rates in the state, do you feel it's appropriate for the board to approve the use of our auditorium for other meetings?
Supervisor Johnson, I would recommend not approving that. And in large part, we're trying to send messages about physical distancing and not engaging in mass gatherings and putting big groups of people together. And I don't see a way to logistically manage that here without someone here to assign seating and to ensure people are sitting far enough apart. And and how do you make that work? Are they wearing masks? And what standards do we put in place? And I think it sends a message, kind of a contradictory message of sorts, of what we're really trying to accomplish in public health and in the county.
All right, thank you. Now, the state has us down that we are seeing an outbreak in a child or daycare center, along with 2 outbreaks in workplace environments. We've used the excuse that long-term care facilities cannot be identified because they are someone's home address. But daycare centers and workplaces are not someone's home address. So can we give the details on these outbreaks?
I will look into that for you, Supervisor Johnson. I'm not aware of those particular sites, so I'll need to get more information. And you said those were work sites?
Yeah, one was a child daycare center also.
Okay, thank you.
Okay, we're seeing more and more investigations that do not come back and tell the public what the outcome on those cases is. For example, we had 400 investigation, the day before yesterday. Yesterday we had a lot. Should we just be holding those and not reporting the numbers until we get them?
I think that's a very good point, Supervisor Johnson. For us to be able to return clean data back to you, meaning that we've We've completed our investigation. We're sure that that case is a Mojave County resident or has a permanent residence within Mojave County, to ensure that there's no duplication of the cases and things of that nature. We would really be looking at probably about a 4+ day delay in reporting cases. And my concern is that puts us off count for a while. And it would be more of a challenge to kind of pick and choose the cases that we report each night based on that. And Mayor, are you still on the line? Because Mayor's been helping pull some of these reports at the end of the day, and the extracts that we pull out of the MedSys database to help us report out to you at the end of the day on the press release.
Right, so what we try to do is get to you as fast as possible with every positive test that's come in, and that's pretty much what Arizona does and what the other counties do. So we want to get you that count right away, even if we haven't had a chance to investigate the case. So you're sometimes getting, when you get your report, you sometimes are getting a case that we found out about an hour ago. So we just might not know much about it. But I think you want to still have that count, because that's now a case that's been identified in Mojave County. So if you don't count that, it's going to look a little, I don't know, strange that you're not reporting it right then when you know there is a case.
Okay, I guess that kind of goes into my next question, because where the confusion's coming from for at least myself and a lot of the residents is that we don't follow up with the next day, which would be hard, saying the 4 cases from yesterday, 2 are at home, 2 are in the hospital, whatever else. And then we've had a few days in a row where we had count adjustments. I would think with the count adjustments, we should do those on a monthly basis, because I think when we're doing them, daily or every other day, it's really confusing to the people. They think we're not telling them the truth,
Sure. Yes.
Is that something that the count adjustment could maybe be done on a monthly basis?
Mayor, I think it can. Am I correct?
Sure, I don't see why not.
Right. Yes. No, I think that would be very helpful. And I understand where you're coming from, Supervisor Johnson. And it goes back to that delaying sharing information about case counts until we actually have all of the information that we need to report it out. And so we've been balancing this line of trying to provide timely information and daily information about cases so people have perspective. But oftentimes what we're finding, and there's some challenges with the system itself, with the MedSys system, is that it takes us some time, several days sometimes, to sort of work through all that information to be able to report it back out in a very clean way. But I also want to make sure that the public understands that while we may not report back on an individual case basis all of those that are under investigation and what that result was, I think what we do ensure happens is that in the graphs and such that we provide you, that information gets wrapped back into the overall report that we provide. So when you look at the, it's those tables and graphs that we provide, those cases are wrapped into that. So as we learn information, it gets included into those counts and into that data set. So that makes it complete. The public just does not see on a case-by-case basis how that moves from under investigation to whatever that result is.
Correct, and I understand they have that information on our website. It's just sometimes, people see the press releases put out, and they look at that and they don't follow up with our web page to see how many people are hospitalized, because that's usually what people are curious about, is how many people we have in the hospital. So those are all the questions I have, Madam Chair. Thank you.
Okay, thank you. Supervisor Gold, do you have any questions?
None today, ma'am.
Okay, I did receive a text message, maybe you have too, Denise, but the governor is doing a press release today at 2 o'clock, and it's going to be live streamed through the Arizona Department of Health Services. So that's azdhs.gov/live.
And if you like, I can send you a link to that. I just received that right before here.
Okay,
And that's all I have for an update.
okay. Thank you very much, Denise. Last chance for any questions from any of the supervisors, comments? Thank you very much, Denise. We'll go on now to item number 2, which is under your name, so you might as well just stay there at the podium.
Yes.
This will be discussion and possible action. Ray, approve amendment number 8 for contract ADHS 17-133195, Public Health Emergency Preparedness, COVID-19 Fund 273-04-5116 between Arizona Department of Health Services and Mojave County Department of Public Health. This amendment covers the scope of work and price sheet for the $302,042 of FEM COVID-19 funding previously approved and is an extension of the existing cooperative agreement. The crisis COAG COVID-19 money is to fund surveillance, intervention, control measures, information management, personal protective equipment, and other items that relate to the COVID-19 response. These funds are not to be used for public assistance in our alternative care site planning. No revised budget is required. Do you have any comments on that?
This is some of the funding that we're using to pay for temporary staff. We're using this funding up first in this stream, and then that makes more sense to us where it's possible. And then we will, if we need additional funding, we'll be coming back to the board to request permission and assistance.
Okay. If there's any, not
Another
any,
question, Madam Chair.
Supervisor Johnson, go ahead.
I'm sorry for breaking in. Thank you, Madam Chair. This will only be used for additional staffing.
It's additional staffing. It can be any control measures if we need to purchase materials, personal protective equipment. We can, and any items that are related to COVID-19 that are going to assist in our public health efforts.
All right, thank you.
Sure.
Any other comments or questions? I'll entertain a motion. I'll make a motion that we approve item number 2 as written. Do we have a second?
Second.
I have a motion and a second. All those in favor say aye.
Aye.
Any opposed? Motion passes. Thank you, Denise. Next item is under Jenny Anderson, Clerk of the Board. This will be a discussion of possible action, approve or deny the use of the Board of Supervisors Auditorium on June 19, 2020, beginning at 6 p.m. by the Northern Arizona Consolidated Fire District Number 1, and if approved, direct staff to work with NAPCRED regarding security, information technologies assistance, and CDC guidelines for holding meetings.
Chairman Bishop, I just have to correct something in there. It's supposed to be June 18th, not 19th. That was my fault.
Okay, so that's June
18.
18th. I've noted that correction. Okay. Are there any comments or discussion?
Madam Chair.
Supervisor Johnson.
Thank you, Madam Chair. I think we've heard from our health director on this, or their recommendation. I think, we're keeping our meetings down until July. We haven't decided past that yet. But I think in order to protect our employees, that while I would like to share the facility with the other entities, government, especially government entities, I think at this time, with all the steps that we need to go through with cleaning and everything else, that it would be short-sighted of us to open up our room, and I would move to deny.
I'll second.
We have a motion on the floor to deny. It's been seconded. All those in favor, say aye.
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 Any opposed? Okay. Motion passes, and it's denied. Next item, this would be a discussion of possible action. Ray, allow the City of Kingman to use the County Board Auditorium for their upcoming June 16th, 2020 and July 7th, 2020 council meetings in accordance with the terms and conditions contained in the attached intergovernment agreement, and authorize the chairman to sign the agreement.
Madam Chair,
Supervisor Johnson.
motion to deny for the same reasons as previous item.
Second.
Okay, we have a motion to deny. It's been seconded. Is there any further discussion? I'll call for the vote. All those in favor say aye.
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 Any opposed? Motion carries. Okay, going on to the next item.
Mayor Schumacher, Public Health.
Discussion of possible action, authorize salary
left the
placement
conference.
of the applicant for the administrative assistant secretary elective position in the assessor's office at pay range A, $22.70 an hour, effective July the 4th, 2020. Is there any questions?
Motion to approve.
Who was that on the phone? Supervisor Angus, are you attempting?
Yeah, I said, 1 second. I'm making a motion to approve.
Okay, we have a motion to approve. Any further discussion? Who seconded it? Jenny? Nobody yet. Right. Okay. Any further discussion? Looking for a second.
Second.
Okay, we have a motion and a second. All those in favor say aye.
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 Any opposed? Okay, motion carries. And this meeting is adjourned.